On today's show, the weather is changing and the 2019 flu season is here. Today we will sit down with Dr. Belkis Pimentel and Dr. Daniel Lopez of Kaiser Permanente Georgia to discuss how you and your loved ones can avoid getting sick this year. And later, we are finally getting it done. The Project Level Up Juvenile Intervention Program, administered by the Fulton County District Attorney Paul Howard and Public Defender Vernon Pitts, is in full effect, and I'm happy to share with you an exciting update. I'm Commissioner Natalie Hall, and the district is next. Every year, over 400,000 people are hospitalized with the flu. In more severe cases, 4,000 to 40,000 people die yearly from the illness. In the CDC's most recent national data, Georgia is shown to have the highest level of flu activity in the United States. That is why we encourage you to take proactive measures that will help reduce your chances of getting the flu. My guests today are lead physicians at Kaiser Permanente Georgia, Dr. Belkis Pimentel and Dr. Daniel Lopez. Thank you and welcome to the show.
Thank you, Commissioner Natalie. Thank you so much for having us.
Tell us a little bit about yourselves, Kaiser Permanente Georgia, and how people can access care to your Georgia locations.
Well, as you know, my name is Belkis Pimentel. I'm a board-certified physician from Emory University for the last 20 years. I've been working at Kaiser Permanente for the last 10 years. And a little bit about Kaiser Permanente Georgia. We are an integrated healthcare model where we have over 800 providers to see the patients.
That's a lot of patients, a lot of providers, 800. What do we need to do to protect ourselves and our loved ones from the flu?
Well, let me introduce myself and Dr. Daniel Lopez, and I'm a board certified as well in family medicine. I graduated locally at Atlanta Family Medicine Residency Program, Atlanta Medical Center, that is. I have been practicing for the past 10 years, and also I have been a Kaiser Permanente physician for the past 5. You mentioned in the second part of your question that how can our members reach us, right? And across not only the metro area, but also rural areas, we are present in 24 locations. All from micro clinics to comprehensive medical centers, all the way, I would say, from sea to China Sea, from Forsyth to Newnan, all the way to Athens, Georgia. Yeah, you mentioned 800 plus healthcare providers between primary care and specialty, all working together for the health of members and the communities they live.
Tell us, how would our viewers know if they have the flu? What are some of the common symptoms?
That's a great question, right? Influenza is a contagious condition, right? It's not a common cold. It's a sudden onset of fever, chills, body aches, attacking the respiratory system, all the way from sinus, throat, lungs. So cough is expected. There is a peculiarities about the younger population. Children can also develop nausea, vomiting, and diarrhea. Very, very confusing. And the fever may not be present in our patients.
Okay, that sounds like so many different illnesses that you could get.
It's severe, and one thing to consider is that especially for the elderly and the young patients with chronic conditions, you should seek medical care the sooner the better. We have way to medication that can decrease the severity, the length of the condition, and it's time-saving interventions.
And when is the best time to get the vaccine? When is it too late?
It's never too late, as I would say.
Okay.
But, and when is the time? Right now is the time.
Okay.
To go and get your family and your loved one protected, and yourself, of course. Ideally, you want to get protected September and October. So for those out there still thinking about it, just go and get yourself, take the important step. Recommendations have been made to get your protection from September to usually May 31st, with some exceptions in the young children. But the best time is now. Do not hesitate.
Why is this the best time? You said September and October. Is that because we're approaching the fall and winter season?
Yeah.
Absolutely. So the CDC recommends that we get our vaccine by the end of October when we start seeing the uptick in flu cases. It takes about 2 weeks for the flu vaccine to work, so we want to have it early on before we start seeing a lot of cases.
Can you receive the flu vaccine when you're pregnant?
Oh, absolutely. It's actually very important to get the flu vaccine when you're pregnant. If you get the flu in pregnancy, you actually get sicker, end up in a hospital, in the ICU, and you can also affect your baby. Now, also, I want to add that if you actually get the flu vaccine, you pass on that protection to your baby for 6 months. That baby's protected. And that's especially important since the babies cannot get their flu vaccine until they're 6 months.
Wow.
Yeah, and at which time they need 2 shots.
Oh my goodness. Well, let's take a break, and when we come back, more with Dr. Pimentel and Dr. Lopez. Stay with us. Welcome back. We've been talking with lead physicians Dr. Belkis Pimentel and Dr. Daniel Lopez of Kaiser Permanente, Georgia. For individuals 65 and older, do they have to receive a special vaccine?
That's a really good question. So actually, the short answer is you do not need a special vaccine. However, there are 2 vaccines out there on the market that are specially made for 65 and over. And they're meant to stimulate the immune system more powerfully because as you age, your immune system weakens. So it's out there, but you don't have to have it. As a matter of fact, the CDC doesn't recommend one vaccine over the other. The most important thing is actually to get vaccinated with whichever vaccine is available at the time.
So that actually goes back to what you were saying earlier about seniors and those vulnerable populations need to be treated quickly, and a lot of times they are hospitalized when they get the flu. Okay.
Absolutely. They make up most of our deaths, the seniors and the little babies, the children.
When you have already received a vaccine, do you really need to receive another one the next year?
So no, you don't get the flu vaccine just because you have the flu or you get sick. You get it to prevent. It takes 2 weeks for that to work. Now, if you're talking about, you get another one the following year, absolutely. And I want to make sure that people, even if they get sick, they realize their symptoms are a lot less. They get minimal symptoms compared to actually having the flu.
Okay,
so you want to get one every year.
You want to get it every year consistently.
Absolutely.
Yeah.
Okay. What are some of the common reasons why people won't receive a flu vaccine? Because I've heard a lot of different stories.
And we hear every day, and during the flu campaign, we go to those battles, and it's our mission, it's our pleasure. But yeah, the most common reason actually is, well, I'm healthy. Why should I get the flu vaccine? And I'm speaking from the heart when I tell my patients, I don't get it only because of me. I get it because of my children. I get it because of my family. Because yeah, I may be, my immune system may be strong, and I may be able to survive and not be hospitalized. But what about my kids? What about my elderly grandmother? What about if you have a family member with chronic conditions? If you are the primary caretaker of a patient with chronic conditions? It's not about ourselves. It's about our family. It's about our community. You may have a coworker that have a chronic condition, and you put them at risk. So every year we go through that, and usually patients respond very well when it comes to protecting you and your family. not only about the loss of health, also the loss of income, the significant economic impact associated with the families as well.
Oh,
Yeah.
yes, because you wouldn't be able to go to work if you
Yeah,
have the flu.
Yes.
We don't think about those extra things that happen when you get sick. That's true. And so, are there any disparities in flu vaccines?
Absolutely. That's actually one of the things that brings us here today. We want to educate the public. There is a large disparity, and what we mean by disparity is racial and ethnic disparity in not getting the flu vaccination. So there are about 3 times more people who are of white race who get the flu vaccine compared to African Americans and compared to Latinos. So we want to educate and talk about some of those myths that the population has so that we can get them to also get their flu vaccine. It's really important. They are a vulnerable population because more chronic diseases happen in African Americans and Latinos.
Yeah.
So, do you think that's due to access to health care, or is it due to just not being educated about the need, or both?
Yeah, all of the above.
Yeah.
Access to health care is very important. Coincidentally, Latinos, African Americans, Native Americans, American Indians, that is, we suffer from very common chronic conditions: diabetes, obesity, heart disease, and chronic kidney disease in higher rates. And we are at risk to have those flu complications. Access to health care is significant. Being underinsured and uninsured also. Poverty makes you relocate more often, so very hard to keep that primary care doctor engaged with you, very hard for record tracking. There is out there. Fortunately, we have a call to action to our providers. We have to be comfortable with health literacy, the health literacy of our patients. We have to be comfortable talking about race and ethnicity. We also have to have certain level of competency, cultural competence to reach out our patients and make them understand that, there is no second agenda. You have to protect ourselves, protect your family.
Yes.
So I want to address the portion about education. We're here to educate, but facts aren't enough. And especially in the African American population, it's about trust. It's about communication.
Yes, it is.
And that really gets in the way. So we have to find a different way to talk to our African American population to have them feel comfortable and trust that the vaccine is not doing harm. It's actually to save lives.
You are so right about that. And so that leads me to my next question. If someone had the flu vaccine and got sick, and now they don't want the vaccine anymore, do you have any natural remedies that you would prescribe?
So unfortunately, there's not a natural remedy again to prevent flu. You always want to eat well, have a balanced, healthy diet, do your exercise. So your immune system is the best, but that is not going in itself going to prevent flu illness. The best thing to do is actually get a flu vaccine. You don't want to wait till you have the flu, then consider that you're going to have the flu vaccine then. So if you had it last year and you got sick, its effectiveness is not great sometimes, but it does sometimes offer some great protection, and we have to think about it as decreasing the risk of serious complications like hospitalizations, ICU admissions, and even death. I know everybody remembers in 2017-18, that year was horrible for lots of deaths.
Yes.
And that's what the vaccine is actually there to help reduce. So it's not just about that you got sick, but did you end up in the hospital? Did you have severe complications that can happen with flu?
So you brought up another question in my mind about, we used to hear about H1N1 and the flu had different names, but we really don't hear that anymore. What has changed?
Well, the awareness of that. We cannot protect ourselves against all viruses. Right? We try to target those that cause the most significant mortality and morbidity, hospitalizations, and death. So most of the vaccines available are trivalent, protect you against 3 viruses, and the majority also are quadrivalent, 4 type of viruses. 2As and 2B, the bad guys, the one that really would cause significant illness. The virus have changes in their structure every year as it goes from person to person, from hemisphere to hemisphere. It changes. Most of the time, the changes are small, and sometimes, unfortunately, they are severe changes. We call those changes mutations. So we all remember the Hispanic flu, the swine flu back in the 2000s, right? How a pig virus jumped into the humans and causes severe mortality. And the last campaign, as my colleague was mentioned. So every year is a chance to get yourself protected to keep up with the virus. The World Health Organization updated this year vaccine based on the result from last year. It was very good for certain strands, H1N1, but was not very good for other H3 and 2. Pretty much it's the name and the last name of the virus, right? We try to put it simple that way.
Yes.
Yeah.
What are some of the ways that the flu vaccine can be administered?
Yes, the most common way is injecting right into the muscle. But there's also a nasal spray that may be a little bit less intimidating for children. And so you can get it up to the age of 49 years old. And also there's another one that's like a jet injector. So you really, for that one, you don't feel it. So that's another way to also get it.
Jet injector.
Yes.
Okay,
It
I
sounds
have an
like
IT
painful,
background,
right?
so you have to explain that one to
Yeah.
me.
So yeah, it just, you don't see the needle and they put it against your skin and you really don't feel much.
Oh, that's good for the people who faint when they see a needle.
Hello, I have wonderful nurses that you may not feel anything at all.
Oh, that's good.
Yeah, I got my protection about 3 weeks ago, and I actually was like, "Did you actually place your vaccine already?" I didn't feel anything at all.
Good.
So,
And is there anything else you'd like to add, Dr. Pimentel?
Yes, I like everybody to know that the flu is serious. Back in 1918, we had the Spanish flu, killed 50 to 100 million people worldwide, 670,000 people in the U.S. That's a lot of people. That's probably one of our worst flu seasons. We want to try to prevent that, so we have to be ready. Get your flu vaccine. It's the most important thing you can do to save your life.
Yes, thank you for that, Dr. Pimentel. We appreciate it. And we'll be right back. Stay with us. Breast cancer is the second leading cause of cancer deaths among women. I had the opportunity to join an esteemed group of public health experts, elected officials, business executives, and educators at the first annual Pink Panel at Georgia State University. The panel discussion focused on breast cancer incidence and mortality in metropolitan Atlanta. Research shows that lifestyle changes can decrease the risk of breast cancer, even for women at high risk. Here are some tips to help reduce your risk of developing breast cancer. Reduce your caffeine and alcohol consumption. Remain active and maintain a healthy diet, avoiding smoking, and avoid forms of radiation and environmental pollution. Lastly, get routine mammograms. A mammogram can help detect breast cancer in its early stages when treatment can be most successful. The Fulton County Board of Health Breast and Cervical Cancer Prevention Program provides eligible women with pap smears, breast examinations, breast education, and mammograms at no cost if you are low income or do not have health insurance. For more information, you can visit fultoncountyboh.org. And finally, By a unanimous vote, the Fulton County Board of Commissioners approved $120,000 out of $500,000 in funding that I requested in the 2019 Youth and Community Services Division budget to start Project Level Up, an endeavor administered by the Fulton County District Attorney Paul Howard and the Fulton County Public Defender Vernon Pitts. Project Level Up is an intervention program which provides juvenile repeat offenders with 3 or more arrests with an aftercare program, mentoring opportunities, and family intervention services. The funding will pay the salaries of 4 staffers through the end of the fiscal year 2019 as the program is being developed and planned. The Fulton County Division of Youth and Community Services and the Public Defender's offices are among the agencies that will support family intervention efforts, while several faith-based organizations have pledged support to provide mentoring services. Among the community organizations that have pledged to assist are the Atlanta Police Foundation, the At Promise Youth Center, the Andrew and Walter Young Family YMCA, the Boys and Girls Club, as well as other community partners. I want to thank you, the residents and community leaders who attended the August Board of Commissioners recess meeting to show your support of Project Level Up. You are the foundation of this movement, and we couldn't have started this program without your input and support. That's our show for today. Special thanks to our guests for joining us, and a special thanks to you for watching. Feel free to contact our District 4 office anytime by calling 404-612-8226 or emailing at district4@fultoncountyga.gov, and be sure to connect with us at FullCoD4 on Instagram, Facebook, and Twitter. Until we meet again, I'm your District 4 Commissioner, Natalie Hall.